everyone, my name is Lucky Malonzo Flores, a student nurse from Systems Plus College Foundation, and today I'm going to show you my return demonstration in assessing my patient's mouth, throat, nose, and sinuses. So the first thing that we need to do in conducting this assessment is to make sure that the privacy of my patient is properly followed by closing the curtain and the door. And then after that, you just need to perform a hand hygiene for you to avoid cross-contamination from your patient to nurse, nurse to patient, and patient to patient. And after performing the hand rub, that is the time for you to introduce yourself to your patient and ask for the two basic identifier, which is the name and the date of birth. So, hi ma'am, my name is Lucky Malonzo Flores, your student nurse for today. Can you please have your name and your date of birth, please? Thank you so much, Miss Girly. And it's really important for us to ask the two basic identifiers so that we are sure that we are talking to the right patient and for us to avoid any mistake in doing the assessment. So, after asking the basic information, all you have to do is to ask a series of questions to your patient, or the subjective data or the information came from the patient. So, Miss Girly, I'm just gonna ask some series of questions. So, if you have any question, you can just ask me all throughout the assessment. We are doing now an assessment with your mouth, nose, throat, and with the sinuses. So, first question is with your current symptoms. Can you ask if you are experiencing any mouth problems such as bleeding, pain, toothache, or any discomfort? How about your nose? Do you experiencing any bleeding, nosebleed, any pain, or clogging? Into your sinuses, any discomfort within the eyes, within the round of your eyes, on your frontal lobe. How about to your throat? Do you experience any pain, difficulty in swallowing? Okay, so how about into your past history or medical history? Did you have any medical procedure or operation which connects to your mouth, nose, throat, and sinuses? How about to your family history? Do you have any family member that have any problem with your mouth, nose, sinuses, and throat? Okay, let's move on now to your lifestyle. What is your usually hygiene with your mouth, nose? Like, do you use toothbrush daily, 3 times a day, taking any supplements? How about your usual diet? Do you follow any fasting diet or any diet? Thank you so much. How about smoking? Do you smoke?
No.
And how about an alcohol? So no need to worry. Thank you so much for your honest answer. All of the information that I'm going to be gathered today will be transferred to your attending physician. So now, we are done getting all of the subjective information. So let's move on now with the objective information by doing inspection, palpation, and percussion. After getting the subjective data from the patient, let's now move on getting the objective data by doing inspection, palpation, and percussion of mouth, nose, throat, and sinuses of my patient. So let's start checking the lips, mucosa, buccal, and the tongue of my patient by checking its color variation, consistency, tenderness, and moistureness. So, Miss Girly, please open your mouth. Please show your tongue. Thank you so much. So, as per my assessment, the lips, buccal, mucosa, and the tongue of my patient, it's normal. However, there is just some dryness of the lips. So now, let's move on with the gums of the patient for us to check if the patient shows symptoms of hyperplasia. Please close your mouth, please. Then just smile. And open your mouth, please. So as per my assessment, there is no bleeding or any inflammation with the mouth, means normal. And now, let's move on with the teeth by checking its number, shape, and color. Please smile please for me. And then please open your mouth. As per my assessment of the teeth of my patient, it has the right number of teeth, and all of the teeth of my patient shows normal by its number, shape, and color. So let's move on now with the color of the tongue. We just need to check if it's pinkish, white, black, or yellow. Please show your tongue. So as per my assessment, the color of the tongue of my patient is pinkish, which is normal. So now, let's move on with the throat by checking the color, consistency, and the torus platinus. So please tilt your head a little. So as I palpate the throat of my patient, it shows normal. The alignment, the color, and the consistency, everything is normal. And now, we're gonna check the tonsils of the patient by instructing the patient to open his mouth and checking the tonsils. Miss Gurley, please open your mouth. We are about to check your tonsils. Please lower your please. And in assessing the tonsils of the patient, there is a grading score that we are following, which is the 1+, 2+, 3+, and 4+. As per my assessment of my patient, it shows the grade of his tonsils is 2+, which is normal. Now, let's move on in assessing the nose of my patient. So, to check the nose of my patient, we need to check its external part and internal part. So for the external part, we just need to check the color, shape, tenderness, and the patency of airflow. So as per my assessment of the nose of my patient, it has the right airflow, the color is normal, and the shape is still normal. So let's now check the internal part of the nose of my patient. We are gonna check if there are any lesions, bleeding, ulcers, or sputum, septum, and polyps, or any destruction to the airflow into the internal part of the nose of the patient. So as per my assessment of the internal part of the nose of my patient, it shows normal. There is no symptoms or any signs of bleeding, ulcers, or any destruction to have a good flow of the airflow. So now we're on the last part of our assessment, which is assessing my patient's sinuses. And in assessing the sinuses of my patient, we need to palpate and percuss. So now, let's palpate for tenderness. So as per my assessment, there is no lesions, wound, or any ulcers that is presented to disrupt the airflow or to disrupt the sinuses of my patient. And now, let's percuss the sinuses of my patient. To see or to check the air versus fluid or pus. So as per my assessment or as per my percussion of the sinuses of my patient, there is no sign of rhinitis or sinusitis or any diseases that can disrupt or that it's presented to the sinuses of my patient. So, Miss Gurley, thank you so much for your efforts and cooperation. So, upon checking with the inspection, palpation and percussion, or all of the tests that we conducted today, everything shows normal with your mouth, nose, throat, and sinuses. However, there's just some hydration with your lips. So what I advise is you can use any liquid form or any medication that can help to hydrate your lips. And you can also do a water therapy for the healthiness of your gums and lips. So no need to worry, all of the information that we gathered today will be transferred to your attending physician. And thank you so much again for your for coming here today. We're done.